Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Wednesday, April the 8th, 2020. Joining us today, Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. First up is Mayor Tory. Mr. Mayor.
Well, good afternoon. I want to start by extending my warmest greetings to Toronto's Jewish community as they celebrate the beginning of Passover at sundown today. As I've said before, but in this time of crisis it bears repeating, Passover is normally a time for friends and families to come together at seders across our city, sharing in festive meals and reflecting on the story of the liberation of the Jewish people. But I know that this year's celebrations, unfortunately, have to be very different. This year, many traditional Passover celebrations have been cancelled to encourage social and physical distancing and to avoid gatherings of large groups. I want to thank families for their understanding and for their respecting of those rules for tonight. I myself will be attending 2 virtual seders, and while I miss being able to be out at large events in person in the community, I welcome the chance to connect online as I've been doing many nights and joining in many of these important celebrations. To everyone celebrating Passover in our city tonight, I say Hag Pesach Sameach. As you know, the City of Toronto was forced to remove 200,000 surgical masks from service yesterday due to the discovery that they failed to meet the quality standards that we require. I'm very pleased to report that the province of Ontario is providing 200,000 replacement surgical masks to us today in response to this pressing need. On behalf of all of us in Toronto, I would like to extend my sincere thanks to Premier Ford and to the Ontario Public Service team for moving so quickly to come to our assistance. It's another example of the good cooperation that has continued between the City of Toronto and the Province of Ontario as we work together to ensure that we do everything we can to help people during this emergency. I'm relieved to hear the Premier say today as well that the province will be ramping up the COVID-19 testing. While the province has the responsibility for testing, this is something that the city and all of us fighting COVID-19 want to see happening as quickly as possible. I accept the advice I have received unreservedly from our healthcare professionals, namely that much more testing will help us to go the way of places like South Korea, identifying cases earlier, limiting the spread, saving lives, and bringing much closer the day when we can close this awful chapter. We are continuing to drive home the importance of people keeping their distance from each other and staying home as much as possible. The City is continuing its coordinated enforcement with Toronto Police Service and the City's parks staff, as well as the bylaw officers with regard to the use of parks amenities, including off-leash dog parks, playgrounds, fitness stations, skate parks, other facilities of that kind, and generally congregating in groups and parking in closed lots. Our COVID-19 enforcement team started a Parks Blitz last weekend, and that all-hands-on-deck approach will continue throughout this upcoming holiday weekend. We have deployed 200 Toronto bylaw enforcement officers in a coordinated effort with 160 Toronto police officers, including community response units, neighbourhood officers, and the mounted and marine units. We continue to refine hotspot locations based on complaint data and in-field observations so that we can target enforcement in the parks with the most amenities, the most activity, and the largest crowds. But believe it or not, despite all of this, despite the fact we are facing a deadly virus and all of the information that's been conveyed and all of the presence people had out there last weekend, people continue to risk their health and the health of their loved ones through some of their behavior. We continue to see, for example, people participating in prohibited activities in our parks, including but not limited to Smythe Park, for example, where a large group of people are parking there at night to hang out. Don Valley Golf Course, we continue to find people trespassing and playing golf at a time when the course isn't even open yet, let alone being off limits. Cedarvale Park, people using the cricket pitch, the dog off-leash area, and the baseball field. And Humber Bay Park, where 2 fires were started on the beach there last night. While the parks themselves are not closed and people are free to walk through them, people need to know that it is our very strong preference and advice, and the advice of our healthcare professionals, that they should stay home except for essential travel or to take a walk or run or walking your dog, but preferably in a quieter area. We have closed playgrounds and other parks amenities, not because we wanted to, but in order to stop the spread of the COVID-19 virus in our community. This is about saving lives. I know people would like to sit on a bench in a park or enjoy one of the Muskoka chairs down by the boardwalk, and that includes me, but we're doing everything we can to discourage that right now. If you really must leave your home, and we are not encouraging that, in fact, we are actively discouraging people from leaving their home, then you can walk, bike, or run through a park, but you cannot, as a matter of common sense, as a matter of health protection, and for that matter, as a matter of the letter of the law, you cannot stand less than a hockey stick away from someone you don't live with in a park or in a public square. We would frankly prefer that you stay home. It is in the best interest of all concerned. You can't hang out with your friends in a closed parking lot. As a city, we are not into hanging out right now in these days of crisis and sacrifice. You can't play cricket or touch football or frisbee with your buddies in one of our public spaces. This is all about making sure you don't get COVID-19, get exposed to it, or get someone else sick by spreading this virus. I want to thank our Toronto Police and bylaw officers who will continue to be out in our parks, principally to educate the public about the need to keep their distance, and will be encouraging people not to linger in the parks. Anyone using a closed park's amenities, such as fitness equipment, playgrounds, or off-leash dog parks, could be fined up to $1,000. Anyone not keeping their physical distance from others in a park could get a $1,000 ticket. Those are big fines, but this is a big battle against a deadly enemy. Again, I know the weather is getting better and we all want to enjoy spring, but all of this is in an effort to stop the spread of COVID-19, save lives, protect our healthcare system, and return to normalcy as quickly as possible. This pandemic is challenging us to do many things differently, so I want to acknowledge the work we have done to help our city staff telework so that they can continue providing residents with the services they need, sometimes now more than ever. Back on March the 13th, the city had the ability to have 1,000 teleworkers working at the same time on our system. That was the maximum amount we had ever been able to accommodate, even on a big snow day. City technology infrastructure set a target of having 6,000 teleworkers by May the 8th. They got to work, and now, a full month earlier, they have reached the targeted 6,000 people able to telework and carry on delivering services to you. And we are now working to have 10,000 people able to telework in the coming weeks. 311 Toronto is also piloting telework, and we're in the process of expanding that pilot so that we can deploy people taking 311 calls from their home, and so they won't have to go away from home and thus be one more person that can stay home as per the advice of our doctor. In the coming weeks, we will be able to have 50% of 311 staff working remotely from their homes. This again demonstrates the innovation and expertise our city staff have and that we need right now. I've told people we need things at wartime speed, not at peacetime speed, and that comes to teleworking, modernizing 311, and a host of other things, and they're delivering on that. The Strategic Command Team met this morning, as it does every day, for its daily meeting, and received an update on the work being done to help the homeless during this pandemic. We've created 350 new spaces in order to create physical distance for people in our shelters, respites, and 24-hour drop-ins. This includes 5 community centres across the city and 3 sites operated by community providers. We've also put up 3 isolation sites, and we have a 200-room hotel site in addition to that. A 400-bed recovery site is being planned now. 12 hotels with 1,200 rooms have been secured to be part of our shelter response. 5 are operational. 7 will be up and running over the coming week. We are working to identify those at greatest risk and moving them into hotels. City staff are continuing to work on securing additional spaces, and we will continue to provide updates on that work. Chief Pegg will have an update on the city's ongoing response to a case of COVID-19 at Seton House. I've also asked Dr. Davila today to provide an update on the outbreaks Toronto Public Health is responding to in long-term care homes, especially the work that the city is doing to address the outbreak at Seven Oaks. I want to end my remarks today by starting where I began, which is about Passover. I hope families celebrating Passover in their own homes tonight, and Easter to come, of course, this weekend in their homes, will know that the measures we have undertaken in response to COVID-19 are crucial to help us overcome the spread of this virus. By staying home now, By staying home now and perhaps not having some of the people you might ordinarily have with you to celebrate Passover or Easter, you are quite literally saving lives, and you are ensuring that this crisis comes to an end as quickly as possible so that we can resume normal gatherings of all kinds in the future. The story of Passover reminds us of the power of hope while highlighting the perseverance of the Jewish people. This is something that rings true now more so than ever. I have hope, and I hope that all of you will continue to have hope, driven by the knowledge, the certain knowledge, that all of us collectively have what it takes to put this behind us. We've got the advice, we've got the smarts, we just have to have the will to do that. And while these are challenging times for all of us, I believe in this city that its residents know that we are all capable of doing our part to flatten the curve. The strong, enduring values and the foundations of this city that made it one of the most admired in the world, they're still there. All of those things are still there, the things that made this city great. And because of that, I know we will get through this crisis and emerge stronger than ever. And I'd now like to ask Dr. Davila for her daily report as the Chief Medical Officer of Health.
Thank you, Mayor Tory, and good afternoon, everyone. As of 12:30 this afternoon, there are 1,570 cases of COVID-19 in Toronto. This includes 1,332 confirmed cases and 238 probable cases. There are 156 cases in hospital and 71 in intensive care units. Sadly, there have been a total of 49 deaths from COVID-19 in Toronto, and I know that you will join me in extending sincerest condolences to the families and friends of all individuals who have died from COVID-19 in our community. In yesterday's update, I indicated that a case of COVID-19 was identified in Seton House, one of 69 shelters for those experiencing homelessness in our city. My team continues to work with staff at Seton House to ensure that enhanced infection prevention and control measures are being implemented, including ongoing efforts to increase physical distancing amongst clients. By the end of this week, another 80 clients will be moved from Seton House to new spaces to achieve optimal physical distancing within this facility. On-site testing is also being completed to identify if there are additional COVID-19 cases. I would also like to take this opportunity to update you on the situation at the Seven Oaks Long-Term Care Home. Overall, we are starting to see a positive effect of the stringent outbreak measures that have been put into place throughout the home, and the rate of new infections is starting to slow down. However, I am very sorry and saddened to report that as of this morning at Seven Oaks, there are 45 confirmed cases of COVID-19 and 56 probable cases amongst the total 249 residents at this long-term care home. 16 COVID-linked deaths and an additional 4 deaths in this home, for which the cause is still under investigation, and 13 confirmed cases of COVID-19 amongst staff. Unfortunately, we anticipate that there may be additional deaths amongst those residents who have become ill with COVID-19 over the past few weeks. I recognize and I appreciate that we are all concerned about those in the Seven Oaks home community, but would ask that we respect the privacy of those who reside in the Seven Oaks community. It is important to note that COVID-19 has an incubation period of up to 14 days, so there is always a delay between when you implement control measures and when you actually start to see the impact of those measures. We are continuing to work closely with Seven Oaks to ensure that all outbreak measures are in place and that staff, residents, and families are supported as best as possible during these very challenging circumstances. I would also like to take this opportunity to thank each and every person working at Seven Oaks Long-Term Care or in any other long-term care home or retirement home for caring for our loved ones. They are responding courageously during these unprecedented times, and they deserve our respect, our support, and our gratitude. On another note, I continue to receive questions about how people can protect themselves against COVID-19. People are especially interested in what role there is for wearing a mask. But before discussing the evidence on mask use, let me first say that the best way to prevent COVID-19 is to avoid close contact with others. This means staying at home as much as possible, and when you go out, to practice physical distancing. In addition, you should wash your hands often with soap and water or use an alcohol-based hand sanitizer to keep your hands clean and free of virus. You should also avoid touching your eyes, your nose, and your mouth with unwashed hands. I also want to share that recently, the Public Health Agency of Canada issued a statement on the use of non-medical or cloth masks. What they said was while wearing a non-medical mask or a cloth mask in the community has not been proven to protect the person wearing it from other people's germs, it may stop you from spreading your germs to other people. This is especially true in situations where it is difficult to keep a distance of 6 feet or 2 meters from others. This new advice that they provided is based on the emerging science that people may be contagious even if they don't have symptoms. So when you do leave your home to seek medical care or for essential supplies, practicing physical distancing is the best way to protect yourself from getting COVID-19. It is also the best way to prevent the spread of COVID-19 to others. In these situations, when you are outside your home, wearing a cloth mask or a non-medical mask can prevent your respiratory droplets and your germs from spreading to others. So putting this all together, what this means is even if you don't have symptoms, by wearing a cloth mask, you may be better able to keep your germs to yourself. I want to be clear though. Wearing a cloth mask or a scarf has not been proven to protect the person wearing it from the germs of others. Wearing a cloth mask or a non-medical mask is also not a replacement for following proven prevention measures, such as staying home, physical distancing, and hand washing. And wearing a cloth or non-medical mask is just one more thing you can do, if you choose to help protect others. If you decide to wear a cloth mask, you should use it properly and safely. This means making sure that the mask fits your face properly, not sharing your mask with others, washing your hands thoroughly before putting the mask on and after taking it off, avoiding touching your face when you put the mask on or take it off, and avoiding touching the mask while using it. Medical masks should be kept for healthcare workers and first responders. We have to ensure that these essential workers have the supplies they need to take good care of us. In closing, I want to remind you that wearing a cloth mask is one measure, just one measure, that you can take to protect others around you. Masks alone will not prevent the spread of COVID-19. You still need to do all the right things. Stay home, stay safe, and take care of each other. I'll now turn it over to Chief Pegg.
Thank you, Dr. Davila, and good afternoon. I will provide a number of important updates today. As you know, the issue of personal protective equipment continues to be one of the challenges being managed within our Emergency Operations Centre. We are continuing to exhaust every viable supply chain option to secure the timely supply of the quality personal protective equipment that we require. As I advised yesterday, immediately upon becoming aware of the issue with surgical masks, we took action and recalled them. We also initiated a full occupational health and safety investigation to ensure that any potential impacts to both our staff and our residents are understood and mitigated effectively. We have also proactively notified the Ontario Ministry of Labour. While this investigation remains ongoing, preliminary results indicate that these masks were used in 2 long-term care homes by approximately 220 city staff. We continue to screen each staff member who enters any of our long-term care homes for symptoms of COVID-19, take their body temperature twice per day, and each staff member monitors themselves for symptoms daily. Additional physical inspections and verifications of all incoming personal protective equipment have been put in place by our Purchasing and Materials Management Division in response to the growing global concerns about poor quality and fraudulent PPE. Yesterday, we received word of a positive COVID-19 case in the Seton House Men's Shelter. A client who is exhibiting symptoms was sent for testing and subsequently received a positive result for COVID-19. Immediately upon displaying symptoms, he was transferred to our isolation site, while Toronto Public Health began their case and contact investigation. Additionally, the person who shared a room with this client has also been transferred to the isolation site. As you know, the City of Toronto has been taking a number of swift and significant steps to help our most vulnerable. Over the last 2 weeks, the capacity at Seton House has been decreased by 40 beds as clients have been discharged. Taking this action has allowed us to limit the use of pre-existing bunk beds and to increase physical distancing inside the shelter. By the end of this week, 100 clients will have been moved to hotel or additional community centre locations to provide for appropriate physical distancing inside Seton House. As I have explained in the past, one of the roles of our Emergency Operations Centre is to plan for the potential impacts for any emergency. Some may refer to this work as worst-case scenario planning. As we have witnessed in other jurisdictions around the world, one of the grim realities of the COVID-19 pandemic is the potential for a significant number of deaths in our city as a result. As uncomfortable and difficult as it is to plan for these potential outcomes, it is the job of the teams that I am privileged to work alongside to ensure that we do. Accordingly, we have planning teams within the Emergency Operations Centre working on a number of worst-case scenario plans. These contingency planning efforts include working directly with the Chief Coroner for Ontario, hospitals, and other public and private agencies to proactively identify various options that could be implemented to increase existing morgue capacity in the event that existing morgue and coroner's facilities in Toronto were to become overwhelmed. Our team is also proactively building service level adjustment plans such that we are prepared to respond in the event that personal protective equipment were to become unavailable due to global supply chain issues. These are 2 examples of the worst-case scenario contingency planning efforts that have been underway for some time and are continuing within the Emergency Operations Centre. I share these examples with you not to cause alarm, but in an effort to be fully transparent and to provide our residents with an understanding of the non-stop planning and preparedness work that is happening within your Emergency Operations Centre. I know that all of this is difficult information to hear, but it is important information to hear. Yesterday, the media reported that the number of deaths in New York City from COVID-19 surpassed the total number of people who were killed at the World Trade Center terrorist attacks of 9/11. This is a sobering reminder for us all about why we have taken the measures we have to slow the spread of COVID-19 in Toronto. All of the actions we take in Toronto are in support of our objective to save lives, avoid overwhelming our healthcare system, and to protect as much as possible our social and economic systems in Toronto and beyond. As always, I encourage everyone to make toronto.ca/COVID-19 your first point of contact for information relating to COVID-19 in Toronto, including the critical city services that continue to operate. Thank you.
Thank you, Chief. We'll go to questions now. Reminder to those on the line that we ask that you limit them to 2. We start with Lucas Meyer from News Talk 1010. Go ahead, Lucas.
Thank you very much, and Chag Sameach, everyone, for who is celebrating tonight. First two, I have a question about construction, but I just want to follow up, Chief Pegg, if you can, on those contingency plans that you were just discussing. Where are you in potentially, releasing more information about some of those worst-case scenarios, perhaps estimated deaths, as the province has talked about? And are you planning on giving more updates about some of those contingency plans, specifically around morgue capacity and the supply issue?
Hi, Lucas. Thank you. So the planning processes that are ongoing within the Emergency Operations Centre are just that. They are worst-case scenario and contingency plans that we need to have in place in case certain aspects of COVID-19 pandemic were to escalate. With respect to releasing forecasts, if you will, or estimates, that's far outside my area of expertise, and I would leave that entirely to our Medical Officer of Health and her colleagues. The specifics around the plans are still very much in development, and as you've heard me say throughout this pandemic, these are circumstances, and this is a situation that is very fluid and is literally changing hour to hour and day to day. And in response to that, so are our planning efforts. So suffice to say that the planning efforts are ongoing. Our commitment is to do everything we can do to be as well prepared as we can be in response to all of the foreseeable and even potential outcomes of the pandemic. As they change, we will evolve with them.
And can you still hear me?
Yeah. Sorry, Lucas, go ahead.
Sorry about that. Mayor, on construction, seeing as how construction projects from the city are still ongoing, and there hasn't been any, according to city staff from today, there hasn't been any indication that any have been shut down. Given that there's such less volume than there was before, do you see or would hope that certain construction projects could potentially be sped up? I mean, I understand that obviously social distancing and physical distancing rules are in place, but with so little, traffic as compared to before, is there going to be any hope or direction maybe to get certain projects finished ahead of time?
As you suggested, and this is something that comes up in respect of every issue we deal with as a team, we have to balance the desire, for example, to get more construction done faster against what might be health risks that are posed by having more construction going on. Frankly, having more people away from home, having more people in groups, gathered together in groups, doing that construction work as hard as you might try to enforce physical distancing. So these are discussions we've had as well, because traffic volumes are down, and that does present an opportunity. But every opportunity comes with a corresponding risk, and I can assure you that anything we could do safely to have some of these projects proceed at a faster pace we would do, but we're not going to do that at the cost of putting people's health at risk. And so we're very mindful of that balance, and we'll continue to make our decisions based on those considerations. But health comes first.
Okay, thank you. We'll go to Matt Bingley now from Global News. Matt, go ahead.
Hi, is Marianne Bedard in the room?
She is. Just give us a moment and she'll switch out with Chief Pegg. Okay, go ahead, Matt.
Hi, Marianne. My question is pertains to a group of homeless advocates that were outside a short time ago who have said that in the shelter system, there are screening is very lax at the doors. People are still sleeping within 2.5 feet of one another, and they take issue with the speed in which people have been moved out into hotel rooms. And I'm just wondering if you can, we've been at this for weeks now. Can you address some of their concerns when it comes to really all of those matters?
Absolutely, Matt. I mean, first of all, I'll address the issue of hotels, and then I'll remind everybody of all the steps that we have taken to date. So obviously, moving a large number of people into hotels is a very complicated issue. We want to make sure that the process that we follow is respectful for the clients that we're asking to move. We also want to make sure it's a tiered response based on people's vulnerabilities, so we're moving the most vulnerable people first. There are also significant logistics involved. We have to make sure that there are staff on site, that we have fire, life, safety checks done, that we have contracts in place for food and cleaning and linen, and also we have to develop a fairly complicated transportation plan. So although it might seem like an easy thing to open hotels and move people, it is quite complicated, but I can assure you that we are moving people as quickly as we can, and that it is an ongoing priority for the city. But as I said, it's just one of many steps that we've taken over a number of weeks. Chief Pegg talked about a swift and significant response, and I will reiterate that we have been doing this for a number of weeks, and we have had a number of actions that we've been taking. So we did create physical distancing in our respites first by very rapidly opening programs in community centres. We've provided funding for our community agencies to allow them to enhance their hours, enhance their staff wages, purchase PPE. We've also been staying in regular communication with our community partners, providing them with communication materials and tools to help educate their staff and their clients. We've been working really closely with our partners in healthcare, both to ensure that we're taking the appropriate steps at all of our shelter sites, but also in the creation of some very unique programs that provide a place for people to isolate while they're waiting for their test results, thereby limiting the spread of COVID-19 in the shelter system. We also took very swift action for people who might have been traveling and creating space for them to self-isolate for 14 days to make sure that people weren't introducing infection into the shelter system. So again, this is it's a multi-tiered, level response. People have been working around the clock. You know, it is sad that we do have people testing positive for COVID-19, but we knew that that was inevitable. This is a very vulnerable population, and we're working very hard to keep those numbers as low as we can.
Could I just sneak in just a quick follow-up before my second question? I'm just wondering if you could tell me how many people within the homeless shelter system have now tested positive?
Yes, so today we have 8 people confirmed as testing positive.
Okay, and I'll keep this quick. Dr. Davila, one of Kathy Crow outside was just saying that she doesn't understand why there hasn't been an order from your office using your powers to ensure that there is physical distancing inside the shelter system, including that 2.5 feet that we continue to see with people sleeping.
So there is an order currently in place, a class order under the Health Protection and Promotion Act, in order to secure isolation for those who are positive for COVID-19 or suspected of having COVID-19. And as you've just heard from Marianne Bedard, our colleagues at Shelter Support and Housing have been engaging in a long list of actions over the last several weeks to create the conditions that best protect the health of those using the shelter system, our respite centres, and as well the staff who work within those facilities. So, you know, at this stage, there doesn't appear to be any merit or need for an order to be given. And as you've heard us say from this table many times, that effective public health measures are best done on a voluntary basis. We only go to issuing orders on an as-needed basis, and in this case, we are seeing the kind of response that we would expect to see from our colleagues in order to best protect the health of the residents within shelter settings and respite settings, as well as the staff who work within those facilities.
Okay, thank you. We now go to Dave Ryder from the Toronto Star. Dave, go ahead.
Hi there. I just want a quick question with Chief Pegg. In reading about these masks, I'm confused based on the comments by different officials as to, one, whether we ordered a certain mask and a different one came, or number two, the mask we asked for came and it was faulty, or number three, city staff essentially ordered the wrong kind of mask for long-term care. Can you tell us exactly what happened with the masks that are inappropriate for that setting?
Sure, thanks, David. So city staff ordered the correct masks. They ordered the masks that we always use, the surgical masks that are always used. What was delivered was subsequently determined to be of poor quality, such that when they were being removed from the package and placed on the face, they had a tendency to rip and tear. So the correct masks were ordered. The masks that were delivered were of poor quality. They were immediately recalled and have subsequently been replaced with correct quality masks.
Great. And then my follow-up to that is, so you provided the extra information about, so you saw, I think you said 200 certainly staff at two city locations, two long-term care homes that have experienced COVID. Do you know at the moment if any staff or residents were infected potentially because there were faulty masks?
Sure. So you're correct. The preliminary results indicate that the masks were used in two different long-term care homes, and as you correctly stated, that number of staff have been identified as having used them. We have no indication at this point that there's any consequential exposure. Although, like I indicated, that investigation, A, is ongoing, and B, all of the necessary and all of the precautionary and proactive screening measures are in place with the full intention and the full commitment to ensure that we're protecting the health and safety of our staff and have every available early screening in the event that someone does develop symptoms.
Okay, thank you. We now go to Jennifer Pagliaro of the Toronto Star. Jen, go ahead.
Hey there. I wanted to find out if anyone was consulted by the province in allowing 24/7 construction, as I understand, is now possible, and whether that applies to not only infrastructure like hospitals, but also condo buildings. Maybe the mayor can just comment on the impact that might have on people, especially since we're all staying home.
What I believe to have been the case is that they indicated they would allow 24/7 construction on critical infrastructure projects. That was the phrase that I read. And if that's so, then I don't believe that would apply to residential construction projects, but rather it would apply in particular. And I think there was mention made in the dispatches of healthcare related construction projects. So I think that will obviously have some impact potentially on people depending on where those projects are located, but I think most people would understand the need for us, especially in these circumstances, to proceed with those projects. And obviously I know from our own experience with 24/7 construction, people take into account the kind of work that they do during those overnight hours when people are trying to sleep, and I'm sure they'll be doing that in this case, but I think that's what it applies to as far as I know.
And I just wanted to ask again about PPE in shelters. There's still a lot of concern. I'm just hoping that someone can be clear on, I know that the city-run shelters are supposed to have a supply of PPE from the city, but that perhaps some of the agencies don't. And what is the direction on whether shelter staff should be wearing that equipment all of the time, some of the time, in what circumstances? Because I think there's a lot of anxiety amongst those workers, given the cases that we're seeing.
Okay, Marianne is here, and she'll answer that question for you, Jennifer.
Thanks.
Hello, Jennifer. Thank you for the question. So yes, we've been tackling the PPE on a number of fronts. We've certainly been advocating very strongly to other levels of government for the PPE that's required. Many weeks ago, we did a comprehensive survey across all of the locations to get a sense of what level of PPE they had and what their ability was to continue to to harness some stock so that we could make a good request to the other levels of government. We also provided $1.2 million out to our agencies to ensure that they had funding if they were able to secure their own PPE and enhanced cleaning supplies. And additionally, we are also distributing PPE out to our shelters. And we've been sharing the advice of the Toronto Public Health on when it is appropriate for people to use that very valuable and limited stock. So again, if you're able to keep the 6-foot distance between yourself and a client, and they are non-symptomatic, then that is adequate precaution to take. If you are aware that someone is symptomatic, then it is very clearly stated in the materials that we have provided that it is appropriate to wear a mask during that period, that you do that screening, and while you interact with that client and arrange for their transfer for testing.
Okay, thank you very much, everybody. That concludes the questions and this briefing, and we will talk to you tomorrow.